We developed the Coronavirus Resource Center after we saw the overwhelming response to Dr. Lauren Gardner's global dashboard. When we saw the public's response and the overwhelming hunger for access to these types of data and reliable information, we realized that there was a bigger need. And President Ron Daniels had the vision for the creation of the Coronavirus Resource Center, that we could build a team to bring together interdisciplinary expertise from across Johns Hopkins University. I'm pleased to say that we now have original content from every division within Johns Hopkins that's featured on the site. Right now, we have over 260 data sources that feed into the site, and we have a team of over 30 experts who range from professors, content area experts, data scientists who review and curate these data on a 24/7 basis. Several months ago, we started to host live briefings, and we take Q&A in real time from the public. The folks that are asking the questions will often indicate that they are a frontline worker or a first responder. And for our team, it's a real privilege to be able to speak directly to that audience. One of the key lessons that we've learned from our work in the Coronavirus Resource Center is the relationship between the public and data. I think that this pandemic has fundamentally changed the public's appetite for data. We suddenly find ourselves in a moment where we have this shared lexicon of phrases like average daily new cases, or mortality rate, or herd immunity. Many of the individuals and groups within our team have never met in person. We speak to each other multiple times a day. It feels at moments like we live together, and yet most of us in real life have never met. We've had many wonderful and exciting moments in the midst of what, of course, has been an extremely difficult and terrible year. But for our team, when we learned that our site had hit 1 billion with a B page views, that was a really meaningful milestone. While at times when you work with this type of data, it's easy to get lost in the data, I'm very proud to say that the members of our team have never lost sight of the fact that each data point is an individual who has a story, and that these are real people and real lives that we're talking about, and everyone is incredibly driven to provide the best, most accurate data and accompanying analysis that we can. We've tried, as the site has developed, to be able to see around the corner as a team, meaning that we try to think, where will the pandemic be in the weeks and months ahead, and what at that point are the key pieces of data that the public or policymakers may be looking for. And we're able to do that because of our collective expertise. On behalf of the Johns Hopkins Coronavirus Resource Center, I'd like to thank Research America for this award, and this recognition means a tremendous amount to our team. I'd also like to thank many of the leaders within our team, including Beth Blower, Jennifer Nuzzo, Bill Moss, and Lauren Gardner. And finally, none of this would be possible without the support of our funders, Bloomberg Philanthropies and the Stavros Niarchos Foundation.